Welcome to the MedLink Health Connections podcast. Today we're talking about cold and flu season with Dr. Teresa Jacobs, the clinical director at the Georgia Primary Care Association. We'll cover the basics, how to tell the difference between a cold and a flu, how to prevent getting sick, and what to do if you catch something. So let's get started. Dr. Jacobs, would you like to start off by telling us what is the difference between a cold and the flu?
Yes, thank you so much for having me. So, the cold or a typical cold is basically a virus, and patients will generally have that congestion, that stuffy nose. Sometimes they will sneeze, have a sore throat. They may even cough. But the runny nose is something that is just one of the key factors of a cold. Now, the flu is a little different. It's caused by a virus as well. But generally speaking, patients will have a fever of at least 100. The thing that is really horrible for most of us when we get the flu is that achiness, the joint pains and the stiffness, and that can really be pretty tough on a patient. Many will complain of a headache as well. May have a cough, might have a sore throat, but the achiness, the fever, and the headache is something that is just seems to be really prominent when it comes to the flu.
Okay, so you've kind of covered some of our most common symptoms. And how would you say someone could tell the difference between the flu or, well, let me rephrase that. How could you tell if someone just has the flu or if it's a cold?
Well, the first thing I would do is take my temperature. So it's good to have a thermometer. With a cold, you generally don't have a fever. All right. So you usually have a regular, normal temperature. The flu, you almost always will have a temperature of at least 100 degrees or higher. So that's the first symptom, the first thing that you need to be aware of. That cold is the congestion. You don't usually have the aches and pain like you do in the flu. But the fever is the first thing that should tip you off. The congestion is the other thing, more so with a cold as opposed to the flu. Fever or temperature when it comes to the flu. So those are the two big things that I would say stands out.
Okay, so what are some of the best ways to avoid getting sick during this cold and flu season?
Oh, that's a great question. I'm sure we're going to talk about getting that flu vaccine. But besides that, we can also talk about just the typical things to do. Hand washing is still also extremely important. Taking care of yourself. Well, by that, I mean getting a proper amount of rest. So sleep is still important, those 7 to 8 hours of sleep. Eating healthy, lots of fruits and veggies is always good to help keep your body nice and strong while we're going through this season. And then make sure you stay well hydrated. There's no replacement for water. You'll hear me say that all the time. So, water, lots of rest, get your sleep, and eat extremely healthy. If folks are around you that are coughing or sneezing, it's best that they cover their mouth when they're coughing and when they're sneezing, and then make sure that they're washing their hands as well when someone is coughing or when someone sneezes. And if you have to be amongst a lot of people, wearing masks is still appropriate.
Okay, you kind of mentioned the flu shot. So can you kind of walk us through why the flu shot is so important and when people should get it?
Yeah, the flu vaccine is one of the number one tools we have in a toolbox when it comes to combating or fighting flu or influenza. The time of the year is usually early fall. I always get mine in the end of August, beginning of September. Takes a couple of weeks for it to kick in, and it will usually protect you through the entire flu season. So right now is a good time to get that flu shot because flu season really starts in September and it lasts all the way through the fall, all the way through the winter. And so we're talking about the end of winter, early spring before the flu season is officially actually over with. So this is a good time to get that flu shot to help protect you during the flu season.
Okay, wow. Do you know if there are any home remedies that may actually help with your cold and your flus and all of the above?
I'm still big on home remedies myself. They taught us hot tea and honey with lemon. Sure, that helps. Honey, believe it or not, has some beneficial health effects. So a little hot tea with honey and lemon, old-fashioned remedy that I still believe in. And of course, if you have running a slight fever or have some aches, things like Tylenol or Motrin is still good for those things. And then it's always nice to have vaporizers, humidifiers in the home. That helps combat, those droplets that are out in the air. Things like antihistamines or decongestants are still good things that you can take. Of course, if you have high blood pressure or diabetes, you want to be mindful of those things that you take over the counter, that they're good for you. Make sure that, because there's some products out there that are specifically for diabetics, specifically for folks with high blood pressure when it comes to the decongest, cough drops, cold medications. You can still take those. And again, you're going to stay well hydrated if you get the cold, have a cold, or if you unfortunately develop the flu. So lots of over-the-counter remedies, but still remember there's no cure for the common cold. So generally speaking, you're going to have to go through it. But those cold remedies that are over the counter tends to help decrease the number of days that you actually experience symptoms.
Awesome. So when someone is experiencing all of these things, when is the best time that they should actually say, "Okay, I think it's time for me to go to the doctor." Like, what are some of those signs instead of just staying at home?
Yeah, so if your symptoms are persisting days and weeks, or they're getting worse, if you have a fever that's not responding to Tylenol or Motrin, if you're a high risk individual, I'm 70 years old. They consider me high risk because I also have high blood pressure. So I'm a high risk patient. So if those symptoms are lingering, you really should go and see a doctor. If you're having, those symptoms like difficulties in breathing, shortness of breath, patients that are having pressure in the chest, confusion, really having some drowsiness, difficulty in staying awake, having issues with dehydration, and even there's some patients who have some bluing when it comes to the nail beds as well as to their lips. Those are really signs that you really, really ought to go see a doctor. You don't want to wait till things get really bad before you go see a physician. Or if you don't feel well altogether and you just want to go ahead. It's better to be safe to go ahead and see a local provider about your symptoms.
And how long are people typically contagious when they have the cold or flu?
Oh, I love that question. And because it's interesting, you're actually contagious before the symptoms actually start.
Oh,
When
wow.
it could, yeah, yeah. And so you don't know that you're contagious, unfortunately. That's why it's always good to just be safe with what we call those universal precautions with those hand washing techniques and covering your mouth, etc. But with the flu, 1 to 4 days, before your symptoms actually start, you're actually contagious. And then while you have the symptoms, it could be up to 2 weeks that you're still contagious. And then after those symptoms start to get better, you could still be contagious even a week or so after that. That's with the flu. And then with the common cold, it's basically the same thing. And so you need to be mindful practicing those universal precautions at all times because it's important because you may have, something that is contagious. And so you want to make sure that you are protecting yourself as well as others around you.
Okay, and can you kind of just go through those universal precautions just real quick for the audience to know?
You're gonna wash your hands always. It's just a good thing to do. Wash your hands. If you're not able to wash your hands, hand sanitizer is still really good. If you're coughing or sneezing, or if someone near you is coughing or sneezing, it's always advisable that they cover their mouth when they're coughing and when they're sneezing. And again, wash your hands to use some sort of septic spray, hand sanitizer on your hands. You also don't want to share eating tools. You don't want someone else to eat behind you. You don't want someone else to drink behind you. So those are what I call those universal precautions. Kids especially, you don't want to eat behind them, and you don't want them to eat behind you, especially during this cold and flu season. So universal precautions. Be mindful of what the droplets, respiratory droplets that are in the air, hand washing, covering the mouth when you're coughing or sneezing, washing those countertops off on a regular basis, whether you're at work or if you're at home.
Awesome, awesome. Is there anything else that you would like to add just before we wrap up the episode?
Well, I think that it is something that we deal with every single year. And before I got vaccinated for flu, I would get the flu every single year. So I
Mhm.
suggest to everyone, if you're not getting vaccinated, if you're not getting your children vaccinated, that you really seriously consider getting the flu vaccine. I think it's a wonderful tool in our toolkits, and for some of us, for kids and for those that are at high risk, those with comorbid conditions, those elderly patients, we're at risk for developing pneumonia from the flu. So that's why it's a great idea to get vaccinated for the flu, so that you can head off the possible complications when it comes to flu. So get vaccinated, get vaccinated. It is the number one thing that I tell patients to do. It is one of the greatest tools in our toolkit to fight or to combat flu and the complications of flu.
Awesome. Okay. Well, thank you so much for doing this with me today. I think myself and as everyone I'm sure who's listening can find this episode very educational. So thank you so much.
And you're welcome. It's always my pleasure. Stay healthy.
Thank you for tuning in to the MedLink Health Connections podcast. We hope you found today's episode informative and inspiring. If you enjoyed the show, please subscribe, rate, and leave a review on your favorite podcast platform. Remember, the information shared in this podcast is for educational purposes only and should not replace professional medical advice. Always consult with your healthcare provider for any medical concerns. Stay connected with us on social media and visit our website at medlinkga.org for more resources and updates. Until next time, stay healthy and take care.